when we think about siblings relationship in general, so maybe you have your own siblings, you have children with a lot of siblings, how would you describe siblings relationship? What is siblings relationship to you? So maybe you can share with the group today in the chat box just to see some of the experience or some of the view that all of you might have. So, a siblings is like a friend to play with, especially when you're at home. You don't have friends coming home, right? You always have siblings who acts like a friends to play. What else? When you think about your brother or sister, okay, nearest role model, companion, someone who we can keep secret with. Yeah. Okay, one more. Okay, as a support. Okay, someone you are comfortable to rely on, someone to talk with about problems. So all of this, okay, and protective. Okay, yeah. Interesting. My my honest answer would be someone who we fight and then can get back together very easily without saying sorry. Yeah, so it's like a love-hate relationship, right? Okay. Right. Thank you everyone for sharing. Okay. So in general, when we talk about siblings, we can say that sibling is the earliest relationship that we have. We learn about having a relationship through the siblings relationship, right? And also it will be the longest relationship that we will have, one of the longest. Hence, through siblings, we are able to learn about love, about loyalty, about anger, about competition, rivalry, right? Because they are the one who we, sorry, who we face every day. And they are our buddies, they are our friends. We will learn sharing through interaction with them. We will learn support with them. Also, we learn how to handle our emotions through conflicts with our siblings. So that's why I shared just now. When we fight, we know we now learn okay how to solve this conflict. And also, growing up with siblings make us emotionally strong. There will always be up and downs of emotions, but at the same time, the people will always be there. And lastly, we will resolve differences that we are having by interacting with our siblings. So these are the general relationship in siblings. Okay. So my next question would there be any difference when we talk about the relationship between siblings of special needs children? Or do you think it might be? Yeah, it's like normal siblings, maybe extra differences, but it will be still the same, right? Okay. Okay. Maybe the one who are special needs might have extra support. Oh, okay. Yeah, the difference might be some of them might not be able to play together. Yeah, maybe we able to feel love, empathy, understanding more, and have difficulty to communicate with. Yeah. All right. Thank you. So based on your answer just now, it is yes, maybe there are differences, and there are also some of the things that are still typically the same with some differences. Yeah, feeling being left behind. Okay, so first thing first, what we've mentioned about the siblings relationship in general are still applicable to the to siblings relationship with special needs children. Why? Because they are siblings. They known the longest. They play together or they interact together. They learn about emotions together. They must have a conflict together. But the main difference would be that there are special needs or there are specific difficulties that the siblings might face. And what is that? What would be the concern? All right. Okay. So, um, Of course, we need to consider that every sibling's experience is very unique. So some siblings might have it more difficult than others, especially if the special needs brother and sisters have different kind of different abilities or disabilities, maybe the physical one, or maybe the developmental one, maybe the autism one. So all the special needs might affect how difficult the siblings might face. Okay, so one of it is like safety worries can pop up when they are facing with challenging behaviors. Sometimes their siblings might show violent behaviors as well. And also, these concerns might not only because of the disabilities or the special needs that the brothers or sisters have, but might be related emotionally on how the others are caring for the special needs children or how they understand the special needs children and so on. Okay. And then this make them feel that they are not important in their own family, or maybe they don't understand why the other sibling gets more attention. And then they might feel different from their peers because they cannot share about their brother and sister because it's different from their peers or friends. They might feel conflict in future. Okay, hence, with that being said, we can now try to slowly answer these questions. Why do siblings of special needs children also need support? In what way? Okay. So when we talk about family with special needs children, the main focus usually will be on the special needs children itself. And also, if we talk about family, we might focus more on parents, especially the mothers, on how they are facing or dealing with their child. Hence, we tend to overlook again on siblings, especially when siblings are really involved in helping managing or dealing with the spectrum, and because lack of coping skills, especially when we didn't realize that they are having that. So there are certain coping skills that they might not learn, they might not develop, hence it also affect them in some other ways. And also research shown that siblings with brothers or sister with impacted on mental health. So I just share with some of the research found when we talk about siblings of special children, they are at higher risk of mental illnesses and other psychological difficulties. So these mental difficulties are likely to lead in challenges in their family relationship with their friends and also how they perform in school, even though they don't have any special need that we know, like their brothers, but can show difficulties at school as well. Okay. I will share a common concern that siblings of special needs children have that somehow create or causing them to feel in a certain way, behave in a certain way, or actually present it in a certain way. Okay. All right. So again, I just want to highlight it that when we talk about these difficulties, we are not undermining or we are not only looking at the negativities. Okay. We are not saying that they are suffering so much. Some of them, yeah, this is one of the excerpt that one of the sibling with special needs shared. So we are not heroes any more than we are victim or sufferers. I am just a person with brother whose condition makes an added complication in my life. And that, like everything else in life, has both its pluses and its minuses. So today we're talking about a little bit about the minuses because sometimes we tend to didn't realize it's not obvious. Yeah, because we want the best for the family, right? So we overly sometimes we tend to say that okay, we need to focus on the good sides, which is very good, right? Okay, but today we just want to raise this awareness and see what kind of support that we can give to the siblings. Okay. The first one would be over identifications. Over identifications happen when a child or when a siblings are having these thoughts of like, oh, am I also have the same special needs as my brother or sister? So children have great observation, but their interpretation might be different or might be wrong or might be, yeah, because the lack of information that they have, the lack of knowledge that they have. So often this thinking might be irrational. So they have immature concept of contagious. Yeah, so they fear catching the disease, for example, like if their brother or sister have cancer, for example, they fear of catching the disease or maybe acquire the same disability with their siblings. Okay, all right. The second one would be embarrassment. So siblings of children with special needs might feel embarrassed, are likely to have this embarrassment contained in their hearts. So maybe because of the siblings are attracting unwanted attention, and this can lead to discomfort and social challenges among their friends, among the society. They might not feel confident to go out with their brother or sister. And sometimes the source of this embarrassment is beyond control, especially when it's related to physical appearances or behaviors. Okay, right. Before I continue, if I am too fast or you missed out what some of my points, do let me know or can let me Shahira know so that I'm not too fast or mislook some glitches. Okay. All right. Okay. So the next point would be guilt. Just now they feel embarrassed. And now they also might feel guilt. So they might feel they are the one who is responsible for the disability or illnesses. For example, they might say, well, if I were born earlier, maybe I will get that these illnesses, for example. They might also feel survivor's guilt. Why I'm the one who survived, don't have that disability or that difficulties. So maybe when they want to do something that they are capable of, they might feel guilty because their brother or sister cannot do it. They might also feel guilt over typical siblings conflict, whereby normal siblings fight. But when they fight, when siblings with special needs children fight, they might feel like, oh, I shouldn't fight. I shouldn't have this fight. So that is also guilt. And also guilt over caregiving, whereby they might feel like they always need to be at home to make sure that they can take care of the brother or sister. So they might feel like, oh, I cannot go hang out with friends because who can look after my brother or sister? And the next one is shame. Okay, when we talk about shame, it's where of the stigma of a disability or illnesses. Okay, so this feeling of shame can make a person feel like, can I not be in this family? Or I just want to disappear. Because when they feel embarrassed, they feel guilty about feeling embarrassed. Then they feel shame about themselves for having these emotions. So these are the things as well. Siblings of children with special needs might feel isolated from parents because of the lack of attention that they might have. They might feel isolated from the information and the process of the brother and sister who are undergoing any treatment, therapy, diagnosis. So they might be isolated from the parents and them. They don't know what's happening. And also they might feel isolated from their peers because of this having a different brother or sister. They cannot share stories like how other peers are sharing. They cannot expose their family. They cannot share what's happening at home because their peers will not understand. Hence, they might feel lonely and lost. They might not having someone to share the similar experience with. If they share with their parents, they might feel like I should not feel this way, be lost. And next one is resentment. So resentment towards the loss of parental attention and time. So siblings might might resent the special needs brother or sister because of them. They don't have this attention and time from their parents. And they might feel unequal treatment. And maybe the brother or sister might have excessive demands because of their special needs. Hence, they resented it. And also resentment regarding failure to plan for their own future or maybe the family future, because everything must be revolved around special needs brother or sister. Hence, they cannot think more than maybe a year because they are not sure what will happen, right? So this kind of resentment feelings might appear. As much as we want to prevent this from happening from our children to feel, they might feel it because it's something that we tend, sometimes it's out of our control. So, and also we tend to overlook these possibilities. And then children, the siblings might feel the burden of the increase of responsibilities. So some might say that I don't like this responsibility. Because of responsibility, I have few privileges for all the work or for anything that I can do on my own, for example. Okay. So yeah, sometimes we just say, Abang, maybe take care of adik, or maybe adik, can you look after abang before when we want to buy groceries some more. So that kind of things, like maybe it's just a small request, right? But for some children, it might be a big responsibilities for them. Hence, it might be a burden for them as well. And the siblings relationship can also be the source of trauma. So when we talk about trauma, it is something that causes lasting harm, and it will affect various aspects of one individual's well-being. So having a disabled sibling or different abled sibling can lead to contributing and unique stresses and also potential trauma. Okay, and when we talk about trauma, it's not only the aggressional, the behavior, the violent one, but it can be emotional trauma. Something that is so emotionally painful can affect them in the long run when they grow up, when they are experiencing teenagehood, right? So anxiety and depression are usually reported by adult siblings with children's special needs as they recall back their childhood trauma, their childhood. Okay. And then having the pressure to achieve. So this pressure to achieve might be contributed when the parents somehow put their expectations towards their children who are not having the special needs, by saying that maybe you need to taking up all the slack, like your brother and sister cannot do it. So who else can do it? It's you, for example. Sometimes it's not directly like that, but the way we behave might possess or might show or portray it is actually what the intention to put the pressure on our children. But at the same time, the parents are not the one who put the pressure on the children. The parents are try their best to just be equal, right? To also consider the siblings' needs. But the siblings might place on themselves pressure, saying that I must do this for my parents, I must do this for my brother and sisters, because I am able to do it. So this kind of pressure can also lead to psychological difficulties, emotional difficulties, and a lot of things that affect their overall well-being. Okay, so with all of these unique concerns that I just shared with all of you, these are the one of the reasons why we want to help the siblings. We want to give appropriate supports to the siblings. We want to create awareness. We want to help educate the parents. At the same time, we want to provide the appropriate supports for the children as well, in for example, coping with this relationship or learning how to manage their emotions. Yeah, okay. And just to so these are the reference for the research or the findings that I shared with all of you. And to end my sharing for today, the unique concerns that they are having is something that maybe not all of them might feel, but some of that, the children, not all of the unique concerns they feel, but maybe one of them must have that the siblings experience. Okay. All right. So that's all from me. Basically, understanding the unique concerns of the siblings can help us to think and maybe reflect on how do we provide support accordingly to the siblings of children with special needs. All right, now I pass back to Miss Shahira.
All right. Thank you very much, Miss Zura, for that very insightful talk. I think we've all sort of developed a little bit more understanding about why actually even siblings also need some help and maybe need a little bit more support as well. So right now we're going to open for Q&A. Okay, so if any of you have any questions, please write them in the chat box and I'll read them out. And afterwards, Ms. Zura will also be answering them. So do you have any questions? Please just feel free to type them in the chat box. So seems like we don't have any questions yet. I guess people are maybe still thinking. So if you do have any questions, don't worry, feel free to just drop us a message at our WhatsApp, or you can also follow us on our social media. All right, but before we end our session today, so we're just going to have a quick introduction to introduce to everyone about our upcoming siblings workshop. All right, so this siblings workshop is specially designed to support siblings of children with special needs. All right, so this will be our first workshop ever, and I think it would be one of the first in the country, perhaps as well. So we would like to provide a safe space for children to express their feelings and also just get to know other children as well, feel like they have a good support network, feel like they have a friend to talk to as well. And especially for this first edition, we will also have a free parent support group. So parents can also get support for themselves, meet other parents who are in the same boat, and just feel free to express yourself without any judgment. So could we have the next slide, Zura? Okay, so what this workshop is about is basically what we want to do is encourage children to just discuss, express their feelings, talk about all the good stuff that they like about their sibling, and maybe some not so good stuff that they are a bit too scared to tell anyone, or they feel that if they say all these negative stuff about their sibling, they will not be a good person, or they will not be a good family member, or maybe their parent will be upset with them. So it is actually normal to have these feelings, and we want to help children to learn, okay, if they have these negative feelings, what can they do about it? All right. Next is also to, of course, acknowledge that every sibling's experience is unique, can be different, can be good, can be bad, it can be intense. But what we want to do is make sure that everyone can know that, oh, sometimes this person will feel this way, sometimes another person will feel that way, and that's okay. Another thing we will also help children to understand is to recognize any concerns they have for like physical and emotional safety, especially related to challenging behavior of siblings with differences or disabilities. Okay, next. All right. Another thing is, of course, as one of our main practices at Axon, we practice a lot of trauma sensitive approaches. So we want to be able to provide safety, focus on developing trust and be transparent. And we also want to enable a good community of peer support, working together, and also empower the children as well. Okay, so who is this workshop specially for? All right, so number one, of course, they should be a sibling of children with disabilities. Could be autism, ADHD, Down syndrome, and so on. Okay, number two, it can be also siblings of children with illnesses or health impairments, such as cancer, with mental health concerns, hearing impairments. It can be children between ages 6 to 17 years old, and also parents who are looking for positive ways to support their child, as well as for parents who want to just, meet other parents as well. Okay, so here are just a few goals about this workshop. Number one, we want to support the children in a very fun way. We will use games, we will use activities, we will use arts and crafts, we will use some role play, and maybe a little bit more about dramatic play approaches as well. Number two is we want to introduce some coping strategies to just help them know, like, okay, if they're feeling stressed, what can they do? How can they express themselves? And provide them a safe space to talk about all of this. And last but not least, to provide some additional knowledge for both the sibling and the parents. Okay, so according to our first session, we will have a parent support group. So we will have a support group that will be led by our consultant, child and adolescent psychiatrist. Okay, so she has over 20 years of experience. So what you can do here in the support group, that you can just talk about anything that you feel and you won't be judged. You can meet other parents, and you can also learn some experiences that other parents and other siblings have as well. Okay, so these are our lead facilitators. So we have Dr. Zasmani Shafi'i, again, our child and adolescent psychiatrist. She's over 20 years of experiences. So I think if you join this workshop, you'll be very lucky to meet her. You can ask her anything, any issues or any questions that you have about your child. And we also have Miss Zura as well, the clinical psychologist, to lead the workshop. Okay, so this is roughly the workshop tentative. So we'll run the program from 10 a.m. to 1 p.m. And then we will have the parent support group that will run from 10 to 12 p.m. Okay, so if you are interested to sign up your child, you can look in the chat box. We have a sign up form there and link. But before we wrap up, we have a few more questions that some of the members of the participants would like to ask to Ms. Zura. So would it be okay to go ahead and answer these questions, Zura?
Yep, sure.
Okay, great. So first we have a question about, do you have any practical suggestions on how to provide the support to the sibling?
Mhm. Okay, so one of the suggestions, practical suggestion would be that one of the main reason, sorry, why siblings might feel certain emotions, might feel left out, sometimes it's because of lack of information about their brother or sister. So being isolated from the information about what's actually as their brother and sister is experiencing, that is one of the reason, one of the possible contributors why siblings might feel a certain way, might feel resent, might feel angry, and so on. Hence, by providing them appropriate, age-appropriate information might help them to have a good understanding, at the same time can help them cope with the emotions a little bit better. That is one thing. But another point would be that for us, especially the adults or the caregivers or the parents, to acknowledge that they are feeling a certain way. So we wouldn't need to like stop them from feeling that. It's okay to feel this, it's okay to feel that, and at the same time provide them a safe space to just open up, and at the same time learn together with them on how to manage these emotions, and as well as to just have an extra time, a special time with the siblings as well. That will be a very good approach as well. And also to maybe send them to a shop as well. There's them the thought bringing that, oh, they are not alone. There are also other siblings that are also having brother and sister with special needs. Yeah. Mhm.
Okay, thank you very much for your answer. Okay, so the next question we have is, in what way can parents identify signs of stress or maybe any kind of emotional strain in siblings? And, when do parents need to worry about?
All right. So, okay. As a clinical psychologist, I would say, especially when their school or their daily life function are affected. So in kids, you see how the functionality of life, how they go about their life, right? In terms of school, especially if, for example, their school participation is getting a little bit regress. Oh, okay. Thank you for telling me. All right. Is my audio better now?
Yes, it is better. Could
Yes.
you just repeat yourself again from the beginning, Zura?
Okay.
Thank you.
From the for the second question, okay? Yeah. All right. So to identify stress or emotional strain in the siblings or in children, we can see from the way they socialize with their peers or they socialize with each of their siblings, the way they conversing or playing with them. Sometimes when they get easily irritated, there is also you can kids have reports, oh, maybe your child started to daydream or not being present in class. So that show that how they function in school are different or are basically affected. So to see these signs of strains, we can easily see it in the way they brought themselves or they just basically being in the community or being with their friends or talking with you as well. When sometimes we can also see like in terms of their health, their physical health can also be affected by their stress as well. And there are a lot of things. So if you notice some changes in terms of their psychological or emotional well-being, yeah, it won't hurt to like maybe go for an assessment just to see their level of basically as an adult, we say mental health. Mental health, kids also have mental health that need to be taken care of. Okay. Yeah.
All right, thank you. And I think the last question that we can have is, could you suggest any activities that can help, foster bonding between siblings and the special needs child?
Mhm. Okay. So actually, this question is I like this kind of questions because I like to think about games. But there are a lot of things that we can just try to think about when we want our child to basically interact with each other, right? So we can also, but most importantly, we need to understand what their interests are. So to start an activity or games, we for sure need to have their interest towards the activities that we want to do. So it shouldn't be like a very complicated game. It can be just like maybe if you have like coloring activity or drawing activity, who can or maybe an for example obstacle course activity. It doesn't like need a physical obstacle course. Maybe like you need to move something from somewhere. So it all depends on also the needs, the special needs child needs. And at the same time, you can tune it up so that the sibling can also have fun with the games. Yeah. If you would like to know more about the games, yeah, for sure in the workshop, we can share a lot more. And yeah, can be updated with our social media as well, just to see like the sharing that we can share regarding the games and activities as well.
All right, so thank you so much, Ms. Zura Ramli, for your time today and all of your wisdom that you have imparted on us. Okay, there's just one question about if there is any support group out there outside Selangor. Well, at this point of time, we are based in Selangor, so we are only able to host inside Selangor, but we will bear this in mind and hopefully we can offer our services outside of Selangor throughout the country as well. So thank you so much to all our participants today who have listened attentively to the webinar. Again, if you are interested to sign up to the workshop, please visit our link as displayed on the screen here. If you would like to know more about our other services, you can go ahead and visit our website. That's axonchildrencenter.com, or you can also visit our social media. That's Axon Children's Center. Okay, so thank you for everyone's attention today, and have a good day. Bye bye.
Thank you, everyone.